Welcome back to the Movement Professional Podcast. Today I'm going to discuss an overview of the best practices for managing blood pressure. I've had a few requests to discuss this from a perspective as a physical therapist and a strength and conditioning professional. I figured I'd give an overview of what the evidence shows are the best practices and then give my anecdotal and clinical opinions on how we should look at managing blood pressure and collaborating with other healthcare practitioners in dealing with this substantial health risk. So first, let's introduce what blood pressure is. The definition of blood pressure is the force of blood pushing against the walls of the arteries. So the normal range of blood pressure would be typically less than 120 over 80. And that has changed over the years. So when I was in school, that was about a 140 over 90. So now the normal range is quite a bit lower than it was then. That's important to understand because depending on when you have your references for, you may feel like you're doing fine with your blood pressure, but not realize that the normal range has changed quite a bit. So high blood pressure or hypertension would be a condition where the blood pressure is consistently above 130 over 80. And that's going to be something to talk about, the word consistently there, and how we monitor blood pressure and how that's changed over time. The importance is that managing blood pressure, it certainly has been demonstrated to reduce the risk of heart disease, stroke, and kidney problems. Best practice number one would be maintain a healthy diet. I've done a couple different podcasts on nutrition and diet, and there's certainly not one healthy diet. If you look at the research that looks at diet and connects it to blood pressure the most, you get your typical incorporate fruits, vegetables, whole grains, lean proteins, things like that tend to show up with most healthy diets. And the whole field of nutrition science is limited in some ways because nutrition is so vast and there's ultimately many ways that we can be healthy with our diet. It's hard to ask the perfect question when we're looking at research in regards to diet, but when they've looked at blood pressure specifically with nutrition, these are some of the things that tend to pop up. Reducing sodium intake tends to be something that pops up. It could also be a bit controversial, and it really can depend on what the rest of your diet looks like. But generally, the rule of thumb is to aim for less than 2,300 milligrams per day, ideally somewhere around 1,500 for hypertension management. Now, if you've ever tried to do that, that's quite low. That could be one piece of something that you're assessing. And ultimately, what we'll talk about is everything that you do to try to modify your blood pressure and manage it is an individual assessment. And you have to be able to be an informed consumer of your health. You're not just trying to take anything I'm saying here or take anything that anyone will tell you and just hold it as a rule without having your own process for assessing yourself. So we've all heard the recommendations for sodium, and when you actually try to practice that, it's quite a bit lower than what would be in a typical American diet. Give it a try, see if it's useful. You'll find that there's many other strategies that might be useful too within what is considered a healthy diet for blood pressure. The DASH diet, or the dietary approaches to stop hypertension, is the most researched diet that connects to blood pressure or hypertension. Basically, what that looks at is reducing sodium intake, focusing on whole foods, limiting saturated fats, things like that. So I don't want this to be a debate on what a healthy diet is, but this is just what the research will show if you do a scan of it for what the healthiest diet is for blood pressure. Best practice number two would be regular physical activity. So I've done several podcasts on what that means, specifically the ones I've talked about with aerobic and cardiovascular exercise. But the general recommendation is to exercise regularly, aim for at least 150 minutes of moderate aerobic exercise a week, which could include brisk walking or cycling, etc. I think the number here is decently important, and not that it has to be perfect, but many times the idea of exercise means something very different for one person than it does for another person. So having some standards for physical activity are very useful, and just having a way of monitoring how much we're doing. How are you planning out your exercise regimen for a week, and having a sense of, am I doing enough? Because for one person, just going out and walking 20 minutes a day feels like, okay, I'm checking that box for regular physical activity. But we do have to have some numbers for what is enough, and that has been somewhat researched. Certainly, you can always do more. Do you need to get exactly 150 minutes? Do you need to do exactly 2 to 3 times per week? Not necessarily, but these numbers are studied, so it's nice to have a broad overview of what to include in a weekly regimen. The other thing is what is included as strength training. So I've done other podcasts with my definitions of strength training, and I go into much more detail about that. But when we get these pieces of advice, especially in regards to things like blood pressure and heart health, we get them from physicians. If you aren't skilled or if you aren't very knowledgeable about fitness, you may have no idea what strength training is and just start to move some weights around and do it for 20, 30 reps because that feels the easiest thing to do with 1 to 2 pound weights. And you're defining that as strength training. So oftentimes it can be useful to have somebody who is educated in this world help you get started with the strength training regimen or do a little bit of your own research. But again, I will put in the show notes some of the other podcasts I've done defining what I think strength training is. And oftentimes it's quite a bit different than what the general population thinks strength training is or what a really basic recommendation from a physician might be. But generally, the benefits of physical activity are that it helps lower, especially systolic, which is the top number of blood pressure, and it can be up to about 5 to 10 milligrams of mercury for improving heart health, and it also helps you reduce weight, which will be another best practice. So if we look at best practice number 3, it would be maintaining a healthy weight, and I think this is something that is important for however you get there, is that we have an awareness of how much we weigh and appreciate that typically finding a weight that's closer to the norms of the body mass index tend to be a little bit better for blood pressure. Right? And there's so much controversy around the idea of weight loss because it is so tied into someone's emotional health that we tend to not look at weight loss as a objective number in healthcare or someone's weight or body mass index as an objective number in healthcare. We're oftentimes very likely to put a caveat around our body mass index. And I think it's helpful not to get wrapped up in any judgment around how we weigh and why we may be overweight as is recommended by a body mass index. And we can always look at other factors that are involved in how much we weigh, such as our muscle mass, such as certain genetic predispositions. But what we want to do is separate out some of the emotional baggage around weight and just appreciate that there is pretty good evidence that if we lose some weight, we will probably improve blood pressure if blood pressure is something that we need to focus on. So looking at our waist circumference, and again, I think it's helpful to put numbers here, not to get too wrapped up in them as exacts, but usually the ranges are quite large, especially for BMI. So finding a way to fit within those ranges to me doesn't seem too out of the realm of what's realistic. But having an idea of a BMI between 18.5 and 24.9, we can look that up. You just Google that real quick about what that looks like. You can get a sense of what your current BMI is just by knowing your height and your current weight. Looking at a waist circumference, which might tie a little bit more into a generic measurement for body fat percentage. If we want to generally keep our waist circumference below 40 inches for men, 35 inches for women to reduce hypertension risk. And all of this information has been studied. Again, we don't have to get too wrapped up in the numbers, but what we're looking at with best practices is not to look at anything as a judgment of what we are or are not doing, but have a little bit of a checklist for some of the things that we're hitting naturally without having to put any effort into them, noticing some of the things that we may feel like are very reasonable if we put a little bit of effort into to making change, and some of the stuff that just might not be on the cards, that even if we put a lot of effort into it, we still can't hit the standards that are being asked of us. And what that will allow us to do is appreciate how much we would be in need of medical management, because we can look at some of these best practices. There's plenty of things that we can do to change our blood pressure, but not all of those things are realistic for the individual. So we can look at how many of those things do we feel like we can change, and anything we don't feel like we can change enough, then we can have hopefully a discussion with a physician about being medicated, because no matter what, it's important that we get our blood pressure under control. There's very little debate about that. So if we look at best practice number 4, limiting alcohol consumption, this could be another area of contention, just because it seems like a judgment to tell someone to stop drinking. There's very little benefit for alcohol use, and the discussion is usually moderate alcohol use, no more than 1 drink per day for women, 2 for men. So if you have been drinking a lot, one of the issues that I've noticed with drinking in my experience is that oftentimes the thought process of how much you drink, what is a moderate amount of alcohol use, is dependent on how tipsy or drunk you may feel. So for 2 drinks for men who have been drinking for quite a while, that feels like below moderate alcohol use. That feels like you're not drinking at all. So the difference oftentimes between moderate drinking and no drinking feels like very little for those that have been drinking quite a bit in their life, because the tolerance for alcohol grows so much. And this is the slippery slope where, for me, I've made a decision to just give up alcohol, because to actually try to be moderate with alcohol use seemed way harder. And I wasn't getting any of the social value that I found with binge drinking or drinking what would be considered way too much. And not only was that unsafe, but even if I brought that use down quite a bit, it would still be well above what is recommended for health. So I think that's one of the more difficult things to think about when it comes to alcohol use. If you're already using alcohol, or you've used alcohol excessively at some point in your life, to bring your alcohol use down to what is recommended for health, you might as well not drink in many of those cases, because it will be such a different experience socially for you that it won't even be recognizable. That's just a personal opinion, some experience I've had, and also just some of the ways that I hear people discuss their alcohol use is they don't really drink that much anymore, but that not drinking that much anymore is still substantially more than what would be considered healthy when we look at some of these standards. All right, and the impact on blood pressure is pretty substantial. So excessive alcohol consumption raises blood pressure and reduces the effectiveness of medications. So that's another important piece, where if you're on medications for blood pressure, they might not work as well if you're consuming alcohol regularly. And again, I think the term excessive alcohol consumption, again, is loaded, because that might not seem excessive for many people that are used to drinking alcohol. But when we look at some of the numbers for health that is considered moderate alcohol use, again, it tends to be way less than what anyone would even think of as moderate use. Best practice number 5 would be to quit smoking if you're currently smoking. And I pulled some of these best practices off the internet with the help of AI, which is amazing for kind of pulling some research quickly. What I've found is I didn't really want to change it too much, because I wanted to just take it from what's out there, what's been studied, but also just from public health messaging. So I always find it interesting that the recommendation for alcohol use is always to moderate alcohol, and for smoking, it's to quit smoking, as if alcohol use is somewhat better than smoking. And I'm not really looking to compare them, but I can't imagine that alcohol use is better than smoking. But the public health recommendation is always to absolutely abstain and quit smoking, and moderate alcohol use. And I just think that has more to do with culturally what we're willing to give up, and how successful we've been in our villainization of smoking, and for good reason. There's plenty of evidence that it is very harmful for almost every chronic disease that can kill us over time. But the idea here is actually quite similar to alcohol. It's for those that would even moderate smoking, it would probably be still too much. So it's just better to make the public health messaging to give it up. And then smoking and hypertension, the smoking certainly has been shown to damage blood vessels and accelerates the hardening of arteries. So very mechanistic, the science that's gone into looking at the downside or the negative effects of smoking on blood pressure. And the benefits of quitting are pretty substantial. So your blood pressure will start to drop immediately after quitting for most people. Long-term benefits also include reduced cardiovascular risks. Best practice number 6, stress management. So the impact of chronic stress on blood pressure is pretty substantial. It's hard to study specifically because, I mean, a lot of times that'll be based on questionnaires given to people just so they're subjectively reporting their levels of stress. But generally, if we look at stress, it mechanistically makes sense because if we're in a state of acute stress, we could really feel how in that moment our blood pressure will be elevated if we were to monitor it. But all of the other effects in the body of hyperventilation, our heart rate increases. If you've ever been in an acute state of anxiety, you wouldn't be surprised if your blood pressure was also increased in those periods of time. So if you have chronic stress, it might not feel like the acute panic attack type of situation, but you'll likely be in a situation where all of your bodily systems are amplifying your heart rate and blood pressure. And if that's happening on a regular basis, then that likely means your blood pressure will be elevated on a regular basis. There has been some good evidence on stress reduction techniques. So practicing relaxation techniques like deep breathing, yoga, meditation. Again, I think a lot of times when these recommendations are thrown out there, the terms are way too generic. And it is useful to have somebody help you along the lines of what does deep breathing mean? What is yoga? What is meditation? So all these terms get thrown out there. There's plenty of apps that can help you with, and you don't usually need a lot of education to get started. But what I see is that people will throw these practices out because they've had one bad experience with them, or they've done something that they thought was a version of deep breathing to help themselves, but they might have actually been making themselves worse because they didn't have an understanding of how the breath connects to calming down the sympathetic nervous system and getting them into more of a state of rest and digest, and how many different options and possibilities there are. So if one doesn't work, you have something else that you can go to. Same thing for yoga. I mean, yoga is just way too general of a term to mean anything, right? And a lot of times I see people get into a yoga practice, it's too boring for them, but they also have to go to a class where it might be 75 minutes, 60 minutes. Like, that's too long for the first time for many people. So appreciating that you can have a practice that might be 10 minutes to start, and it can still be in the realm of yoga. Same thing with meditation, right? There's so many different ways to get into any of these practices, and they are practices that are processes, not drugs. They're not medications. So you're not getting things prescribed. You're getting a process started. So I think again this becomes problematic with some of these best practices when the advice is just thrown out there as, all right, I got to get physical activity in, I got to get strength training in, I got to get my stress reduction techniques in, and we're checking boxes, but we're not appreciating that they're ongoing practices that really don't have an end game. You just keep building. If you have that mindset where it's a growth mindset with some of these techniques, it's a gift that keeps on giving, where you will not only reap the benefits of them, but you'll discover new benefits that you didn't even anticipate would be part of the process. And when we look at stress management, we want to set realistic goals. So we want to try to reduce sources of daily stress, which can positively affect our overall blood pressure. So really taking an inventory of the stresses that come to us throughout the course of our day and trying to give ourselves small goals so that we can get small victories and then build on those victories over time. The practice of cognitive behavioral therapy, which is often aided by a skilled psychologist, can really help that because it can give you very specific things to work on and give you exercises that will help you find these small victories, and then you can build on them. And again, it becomes very process oriented. So you get better at reducing sources of daily stress in your life. And then you actually feel that might become a strength for you where it was a weakness in the past, or it might have been something that was leading to high blood pressure. Well, now you feel like not only do you have better stress management that's helping your blood pressure, but it's making you more functional in daily life. Best practice number 7, I think this is one of the most important ones, is monitor blood pressure regularly. So getting a home monitoring tool such as an Omron cuff, or there's so many good cuffs out there now that there weren't 20, 30 years ago. It just, the idea of home monitoring for anything in health is so much better than it used to be. But many of us might still be behind in understanding that that's important, right? So the old way of measuring blood pressure, I'm 41, but just thinking about how my parents had their blood pressure measured, and they still might be in that boat, is, you get one measurement every 6 months. You might get it a little bit more frequently if you had some high blood pressure monitor readings, and then you would have to go in more frequently. But very rarely was it done at home. And to me, that if you're not monitoring yourself with blood pressure, you have very little awareness of how your blood pressure behaves. And you may go into your doctor's office and get a regular normal blood pressure reading, or a high blood pressure reading, and it may not be that relevant to what your blood pressure is most of the time. And I've certainly experienced this in my own life, where my blood pressure readings are very different every time I go into a medical practitioner's office. And sometimes they're more stable than I get when I'm monitoring myself. But one of the things I also notice when I'm monitoring myself is it really depends on the day. It depends on the position. It depends on the time of day. Depends on if I've had caffeine, what I've eaten. There's so many variables that can be controlled, and it gives you much more education on how your particular blood pressure is affected by different things, right? And so that's going to be really important, because anything that you try to adjust from any of these best practices, especially if you go down the road of medicine with your medical practitioner, hopefully they're making it important that you're also monitoring yourself and seeing if any of the medicines that are being prescribed to you are actually useful. And I think without that, we're putting a lot of faith in that, well, just give me a medicine and it's going to do what you hope it does. And I think medicine is huge as far as management of blood pressure. And it's absolutely something that we should not be afraid of, but we want to use it like we would use anything else. We don't want to just set it and forget it, but we really want to be monitoring it. And I think anything in healthcare, we have to be willing to monitor change, because that's what we're looking to do. We're looking to make a change to something. So if we're not monitoring that change, we're just guessing. Or if we're monitoring once or twice a year, then we're really just guessing if it's helpful, and we're crossing our fingers. So being able to monitor yourself regularly, you get a lot of information of how blood pressure responds to different situations. So anecdotally for myself, one thing I noticed is I get up really early in the morning, and usually I should have like a lower blood pressure in the morning, but sometimes if I wake up in the middle of a deep sleep, or a dream, or something, and I'm a little bit shaken in the morning where I didn't wake up naturally, my blood pressure will be higher doing that. So it really depends on how I wake up in the morning for how my morning blood pressure is. But then there'll be times after a mid-afternoon nap, I wake up, it's way better. If I lie on my back, it's way better. If I'm sitting up in different positions, that's different. If I have my arm in different positions, that's different. Typically, when research looks at what are the norms for blood pressure, they also put their subjects in way more relaxed conditions so that they can standardize them than we would get if we're going to a doctor's office, or even if we're monitoring ourselves. So one of the things that I find interesting is just taking several measurements that might last for 3 to 5 minutes. The blood pressure goes way down just with going from my first measurement to, say, my third or fourth measurement, just because time has passed. I've spent more time in a relaxed position. I've actively done work to bring my blood pressure down. So blood pressure readings, self-monitoring, actually can become a nice biofeedback for relaxation and stress management if you use it that way. Now, obviously, you should consult with healthcare providers. I consider myself a healthcare provider, but not someone who can prescribe medicine for blood pressure, but certainly have an education and understanding of it. And I would look at having multiple people that you're discussing your blood pressure with. And if you feel like the healthcare provider you're seeing is a bit dismissive with any questions you give, seek someone else out, because it's important that you have a communication with your healthcare provider. And sometimes the healthcare system doesn't allow for enough communication with certain healthcare providers just because of a busy schedule. So it's really important that you feel comfortable asking questions and having your healthcare provider be an educator for you, not just a prescriber for you. Best practice number 8 is medication management. So this is by no means best practices in order that medication management is last. It might absolutely be first. So follow the prescriptions if they're provided. But I think best practice number 7 has to go with best practice number 8. We have to be good at monitoring ourselves if we're taking medicine so that we are right on top of the changes that are being made. Sometimes you get some medicine and that works too well. You had high blood pressure, now you have low blood pressure and feel like you're going to pass out. Well, you'll be able to monitor that quicker and be in communication with your healthcare practitioner quicker if that happens. The other thing that I think is important here is there's different types of medication. And this can go well beyond the discussion of blood pressure management, where we've had one bad side effect from a medicine, but we think, okay, well, medicine doesn't work for me. But there's all different types of medicines that have different mechanisms for blood pressure. So you get your ACE inhibitors, your diuretics, your beta blockers, calcium channel blockers. And I thought, I'm 41, but I'm getting to the point now where I have to look at some of these things that I may need chronic medication for. I'm trying my best to stay as healthy as I can, not to avoid medicine, but to make sure I'm checking as many other boxes from the best practice standpoint as I can. But just in having discussions with my physicians, and I have a physician that's a primary care physician. I also have a physician that is a specialist when it comes to lipid management and also blood pressure, just because I wanted to be on top of that and I want to get multiple opinions when the time might come if I need these medicines. But one thing that was very reassuring to me was that I had this conversation with this lipid specialist, and he looked at my level of health, and he said, if you do need medicine for your blood pressure, I wouldn't give you a diuretic, which I had been prescribed in the past, but I would give you more of this ACE inhibitor that I'm currently taking that might be more specific to where you are from a fitness standpoint, from a health standpoint. So just having that appreciation that for different bodies, there are different medication options, I think is really useful. I certainly wasn't up to date with all of the medicines that are available. And sometimes you look at some of the medicines that are offered and they might get prescribed just because that's what you do for the first time somebody's got an issue with blood pressure. And they might not take into account that it has some side effects that will really get in the way of other physical endeavors. But if that happens and you have some side effects that are negative, just know that there are other options out there, and that's for you to discuss with a physician. And this is, to my point before, is like if you don't feel like you can ask questions to your physician, maybe find someone else that you can ask questions with, because it's going to be important. There's a lot of different options out there, and if you're self-monitoring, you can see what's working from other lifestyle changes you can make, but you can also see like, okay, I'm checking a lot of these boxes, and it's still not satisfactory to where my blood pressure readings are. That's where medication is absolutely necessary. We should not be afraid of it, and we should be willing to make changes and have communication with our physician. So we want to be on top of it. We don't want to just say, okay, I'm just this guy who needs to be on medicine. Maybe you do, but maybe you don't want that medicine to be gradually increased over time. So you check all the other boxes you can with the best practices, but you certainly don't want to be afraid of medicine, because it might be absolutely the most important thing for you. And again, work with your doctor, regular check-ins, monitor yourself. So in conclusion, improving blood pressure requires a combination of healthy diet, regular exercise, weight management, reducing alcohol and smoking, stress management, medication, and monitoring. Right? So, we talked about a lot of different things. And I think one of the problems tends to be that some of these recommendations are just too broad. Healthy diet, what does that mean? Regular exercise, what does that mean? Weight management is a little bit more direct, but how do we get there? Right? It's not easy. And then even just the discussion around alcohol and smoking, so much of that is tied into what we think moderation is and not necessarily connected to what evidence shows moderation is. So it's good to have an appreciation of all these things. And I think that the number one takeaway here for me is you do not have to feel like you need to do all of these best practices, or you can assess the best practices and appreciate what comes easy to you, what's really a stretch in your current lifestyle. And we shouldn't have a sense of guilt when we look at recommendations for lifestyle changes. And I think that comes across too much. And what that leads to is ambivalence, where we feel guilty about something, and then we can also look back at the person giving us that advice and say, well, are they doing that too? And we look at with enough people in our lives that are not making the changes we can always find the reason not to change something. And it's really up to you whether you want to make changes of this. And that's where I feel like medicine fills in some of those gaps. It's not perfect by any means, and you'd rather not have to be highly medicated and chronically medicated, in my opinion. But we shouldn't be afraid of medicine, and depending on what we're willing to do and what we're willing to change and how much time we're willing to put into some of these things in our lives, then medicine absolutely could just fill in that gap. And even if we are really doing everything as diligently as we can, we still may need some medicine for a variety of different reasons, genetic purposes, things like that. But the idea of the best practice is to get a sense of, okay, what can I do naturally? What am I already good at from a numbers and a standard standpoint? What do I need to put a little bit more work into it? And very importantly, it was what am I willing to put some work into? And without guilt, saying, okay, I'm not willing to give up alcohol. I'm not willing to put that much time into exercise. That's fine. I don't think it's realistic for me to get my weight within the BMI parameters that are offered. No judgment, but that's where you have to appreciate that, where it's okay. There's a lot you're leaving on the table. That's where we might have to fill that in with medication, and then take the monitoring piece seriously, because that makes the medication, I think, a little less scary. So I'm going to put this slideshow on in the show notes, because there's a ton of references that you can trace back to what I'm discussing here. I'm hopeful to start a conversation with the audience with this discussion. So if there are some things that you don't agree with, if there are some things that you aren't clear on, just ask me some questions. You can hit me up on Facebook. You can find me on Instagram. Just send me direct messages. You can also just send me an email at chris@movementprofessional.com, and I'll be happy to get back to you. And maybe I'll directly address your concern on another podcast. See you next time.